My name is George Carr. I went to University of Missouri, Columbia for both medical school and residency, and then spent time working in Boone's emergency room, as well as the emergency rooms here in Jefferson City before deciding to go into private practice. When I moved to Jefferson City, I started working with Dr. Tom Robbins, and we joined with the internal medicine group that was on the floor up from ours, and that's what began Jefferson City Medical Group. JCMG made a large impact, especially when we first formed, because there was nothing else in town that was similar to that. You see that the quality go up if we have physician ownership. You see it here definitely in patient satisfaction on a lot of levels. So we've tried to see that, essentially if the doctors are the owners as well as just practicing, they can do a lot more and accomplish a lot more and hopefully do it at a lot higher level and higher quality. The primary care doctor's role, his job, is to cut through the red tape. If we have somebody that needs to be seen and needs to be urgently seen, your job is basically to make that happen. And so in a very immediate way, I have the ability to walk up and talk to them upstairs or downstairs. I have the ability to basically review cases with them easily. It's not a difficult process to get a hold of them or talk to them or call them. And all of us interact well and have a good relationship in this group. I find that the biggest, most positive aspect of practicing is the relationships that I've developed with my patients over an extended period of time. I've known a lot of my patients for between 30 and 40 years, and I've got to watch them grow up as well as have kids of their own and see those children as well. And so I think the relationships that I've developed over that time period has probably been one of the most gratifying part of it. Being in Jefferson City, it's very similar to that because it's a smaller town, and so people appreciate those relationships more, I think.